Hi, I am Dr. Arun Mukka, consultant endocrinologist at Yashoda Hospital. Many people ask us, what should be done to have a good control of diabetes? Let's learn about that today. Before we talk about the way to control the diabetes, we need to understand what are the types of diabetes. Now, broadly, diabetes can be categorized into two types. The first type, which is an uncommon type, which is seen more often in the children, is called as type 1 diabetes. In these, there is complete absence of insulin production in these patients who develop type 1 diabetes. Because of the lack of production of the insulin, these patients need to be treated with the insulin forever, for lifetime. Now, the insulin shots sometimes needs to be given 2 times a day, sometimes 3 times a day, and sometimes, if required, 4 times a day if the need arises in such type of patients. Now, coming to the common variety of diabetes, that is the type 2 diabetes, which is contributing to more than 95% of the diabetic pool. Now, why people develop type 2 diabetes? Now, type 2 diabetes people develop because of a phenomenon called as insulin resistance. That means the ability to produce the insulin in the body is retained. Or for that fact, in some people, the production of the insulin is also increased. However, because of certain factors which lead to the insulin resistance, namely a very poor lifestyle, excessive weight gain, too much of weight gain causing the obesity, can cause this phenomenon called as insulin resistance. Now, when people develop insulin resistance, what happens? The insulin which is present in the body is not able to execute its function correctly, because of which we have to give medicines from outside which will let the insulin do its job correctly. We call these as oral hypoglycemic agents or oral anti-diabetic agents. So in type 2 diabetes, we start the patients who have uncontrolled sugars on tablets, which we call as oral hypoglycemic agents. We adjust the medicine if required once in 2 weeks, if required once in a month, or sometimes once in 2 to 3 months. We need to follow up these patients, adjust the medicines according to the fasting and the post-breakfast blood sugar control, accordingly give them a good control and follow it up regularly. However, it so happens in about 30 to 40% of the patients with type 2 diabetes over a period of time, like say after 10 years after the onset of diabetes, they may also become requiring the insulin. Now, we need to start the insulin in those subjects who are not having a good control with the oral anti-diabetic agents. Now, again, in these patients also, insulin might have to be given once daily, twice daily, or 3 to 4 times a day to have a good blood sugar control. Having said that, the diabetes control is not just by means of tablets as well as insulin. The lifestyle modification plays a very key role in having a good and sustained blood sugar control over a period of time. So what do you mean by the lifestyle modification? And what do we mean by this? We need to understand that. Lifestyle modification means having a good exercise regimen regularly in place. At the same time, taking the diet properly. So having a regular exercise is very important. How much exercise should we be doing it? 30 minutes of simple brisk walking for at least 4 to 5 days a week for most of the days in a week, which amounts to 150 minutes of exercise, is actually adequate enough. So much is the strength and the efficacy of this walking of 150 minutes per week, so much is the efficacy that even in the subjects who have pre-diabetes, that is the borderline diabetes, the development of diabetes in the subjects with pre-diabetes can be avoided in about 60% of the people. Such is the efficacy of having a regular exercise. You can opt the exercise of your choice. We generally recommend walking because this is something which can be done by people of any age group. It can be done anywhere, it can be done any season, it doesn't require any expenditure. If a person is interested in doing any other sporting activity, like a person is interested in swimming, or if he wants to play some racket game, no problem, you can go for that. But make sure that there is a physical activity of at least 30 minutes for at least 4 to 5 days a week. What happens by having a regular physical activity? The efficacy of the molecules is also enhanced. A low dose tablet can also give a good blood sugar control. If you don't do the exercise, these patients may require a higher dose of tablets, sometimes higher dose of insulin. So that is the importance of having a good regular exercise. Now, coming to the second aspect of the lifestyle modification, the dietary patterns. Having said about the exercise, we also need to know what exactly a diabetic person should follow, what exactly should be eating to have a blood sugar control. Now, before we talk about a good dietary pattern to these patients, it is always important to emphasize that it has to be a family policy. We should not be telling that it is only the diabetic patient who should be following the exercise, or it is only the diabetic person in the family who should be eating a proper diet or adequate healthy diet. What is important to emphasize is the diet which is to be taken by the diabetic patients. If it is taken by all the members of the family, it ensures the good health of all the family members. At the same time, it is also motivating for the diabetic person to stick to the dietary regimen. He also gets motivated as all the family members are following the diet. It doesn't get deviated with a proper dietary regimen. We need to see to that a lot of healthy food is incorporated in the diet. First and foremost thing, have a regular diet. Please do not skip breakfast, lunch or dinner. It is very important to have the major meals in the place. At the same time, incorporate snacks between the major meals. Between the breakfast and lunch at around 10:30, have a snack. Between lunch and dinner at around 4:30 or 5 in the evening, please incorporate a snack. What should be eaten? Please take snacks in the appropriate time, but should be eaten on the major meals. If you go by the Indian diet, you can ask them to take the cereals or any tiffins. See to that they are not fried or deep fried or stir fried. You can take something like idli, dosa or upma in a small quantities, but not in the large quantities, and see to that the fried food is not there in the major meals. When it comes to the lunch and dinner, many people ask us, doctor, what do you recommend to eat? You recommend to eat rice, or do you recommend to eat chapati? But first and foremost thing, what is important is how much are you eating is very important. We generally recommend those diets which get digested little slowly. A sustained digestion happens, so the sugar levels in the blood goes in a sustained way. These diets are called as low glycemic index diets. Now, if you see the glycemic index of the rice, chapati, the glycemic index of the rice is more and chapati is less. That means for the same amount of chapati or the same quantum of the rice when it is consumed, the amount of or the degree of rise in the sugar after the intake of the rice is more when compared to the elevation of the sugars after the intake of chapatis. That is the reason why we recommend chapatis. Eat small quantities. See to that the food contains lot of naturally preserved food, lot of boiled and vegetable or less processed food. See to that it is not deep fried or stir fried. The tubers, that is the vegetables which are going underground like potatoes, they need to be restricted. The other green leaves, other vegetables which grow over the ground, they can be taken in abundant amounts.